Hola guys, happy Saturday. I hope it turns into one. I am outside of the dentist. It's still dark. My appointment's at 7 a.m. I've never been here before, but my family has used them. The abscess in my tooth, well, on my gum, was really being nasty yesterday. The pain was terrible from around 2 o'clock on, and I just had to grin and bear it at work. I mean, even my 4 ibuprofens, my ibuprofen and Advil cocktail was not working, and then I was like, I'm taking way too much of this crap. But it looks like a very nice office. I'm scared. I'm anxious. My insurance is out of network with this place, but because it's familiar and comes highly recommended, I came. They offer all kinds of financing plans. I hope I qualify for one. I tried to do the care credit, and according to the Google, doing it online solo as opposed to through your doctor's office or veterinarian or dental office can sometimes be a nightmare. Because I was qualified for a certain amount, and then you have to do all this identity stuff. You have to take a video of your face like this for identity purposes and take a picture of your driver's license and all that. So initially I was told, you qualify for this sum. I'm like, oh, good. And then I did all the security stuff, and by the time I went back on to continue with your application, I was told that I did not qualify. So I was confused, and then I Googled it, and a lot of people have had that issue, and then it ends up straightening out when they try and do it at their doctor's office or veterinarian's office or whatever. Care credit is just a line of credit that you apply for to help pay for medical bills for you or your pets or whatever, in case you don't know. So I was like, well, that didn't work. So hopefully I qualify for one of these insurance plans. They have 3 or 4 of them, just to get on the payment plan here. I don't know what they're going to do. I don't want to think about what they're going to do, but I was so scared yesterday until I couldn't stand the pain anymore. So I knew I was going to have to come. I can't stand this pain. Nothing is working. And this is the longest that a toothache with regards to this tooth has ever lasted. But the pain was so severe, guys, and I'd already decided and already known that I'm gonna have to, come in, be a big girl. But the pain was to the point where I was whimpering, and my gum was so tender. It felt like it was on fire, like a burning and an ache at the same time. So I looked in there, and I'm like, aha, the abscess had come to a head. You could see where the pus was. You could see right under. So I sterilized some dang dental tools that I had, brand new kit. I sterilized them suckers, and I hacked away at it. I didn't have to hack away at it. I did 2 pokes, and this white gush came out. It wasn't foul smelling or foul tasting. It was just white. It looked like milk. So I pierced the actual sty or abscess, whatever. I know a sty is in the eye. Whatever it was, a little sac, I pierced it, and it leaked out, and then it bled a little, and the pressure was gone. The pain was gone instantly. So I rinsed my mouth and just whooshed, and cleaned my mouth with peroxide and mouthwash, and did a saltwater rinse, and but like 2 hours later, it started filling again. I could feel the pressure and the pain, and right now it's painful. I haven't taken any pain meds because I don't know what they're going to do today. I don't want to be totally doped up. I do know for a fact I'm not going to be able to request any sedation that I want because I'm driving. If anything other than your local anesthetic or Novocaine, you're not allowed to drive on it. And I would never take that chance. So if I qualify for insurance in here and or I can afford it on my own with my own funds, I'm just gonna go ahead and let them do whatever they have to do to offer me some relief, to clean this mess up and offer me some relief on just regular sedation and Novocaine, because unless they suggest that it's gonna be more, you know, in-depth kind of disgustingness, then I'll have my brother bring me tomorrow and drive me home tomorrow. That's the plan. But what time is it? It's 6:52. My appointment was at 7:30, but when I called to ask a million questions yesterday, she asked if I could just show up at 7. So that's what I'm gonna do. I'm seeing all the staff show up and all their little scrubs and buzzing themselves in. The lights aren't even on in the lobby. But well, there's one patient. He's dressed too casually to be a dentist. What heck he could be? I don't know, but he's walking in. I wonder if I should. Yeah, he just walked in and sat down. Maybe I should. Well, guys, that was a whole experience. I have goths in my mouth. That's why I sound like Mike Tyson. Or maybe because my whole mouth is swollen. I don't know. But I am so glad I did it. But I do have an infection that was under 2 of my teeth. They went ahead and pulled the broken one and an impacted wisdom that had a little bit of decay on it, and it was a little decay on the side. So she was like, you know, we can save the tooth, but with the gaps that'll be there, and the positioning of it, and it not really having any kind of purpose back there, the way it was stuck out there, they gave me the option to remove it. So I just said, let's go for it, because I ain't coming back. I mean, I'm going back. I have to go back. She found 2 cavities. They want to do a cleaning. They were going to do the cleaning today, but with everything that I chose to have done, they're like, no, it's okay. We're just going to focus on getting the infection out, the tooth out. I went ahead and opted for them to pull the wisdom, and then I go back in a week for a follow-up, and then I can make an appointment for the fillings or the cleaning. There's just a lot to do. And then I have some very bad molars back here that they're chipped and not in the best shape. I do have a lot of damage to my teeth from just not taking care of my teeth the way I should, and you know, eating disorder, and my teeth are damaged. My teeth are damaged, and so there's work to do. But they said my bones look good. Considering my history, my teeth are better than they should be considering my history. So the procedure itself was not as bad as I thought it was going to be. The anxiety first injection. The staff is amazing. They were understanding and gentle and very caring. But as usual through life, I try and fake a front. And I explained to them I was very anxious, very nervous. But I didn't explain to them how anxious and afraid I am of needles. Because that's what I was afraid of. I was afraid of the needles, the injections to numb me. That's what I was afraid of. When I tell y'all my fear is real, it is debilitating. Which is why I let my teeth get the way they did, because I didn't want to get poked. And I said as much. I'm scared of needles, but I didn't stress it enough so they saw as I'm freaking convulsing and curling up into a pill bug on the table. I was so embarrassed. Thankfully, though, I have them so often and have experienced them in my life so often that I now am able to focus and not completely dive into them. I'm able to understand it's just a panic attack. You're okay. You're safe. I'm able to talk myself down some. The only thing about those panic attacks that still really terrifies me is the pain. They're very painful. You get a lot of pain in your chest, and even though I know I'm not having a heart attack, part of me feels like I'm having a heart attack. What if this is an actual heart attack? That's the scariest part of it. So I can calm myself down. I can focus on something. I can get control of my breathing pretty okay on my own. But the pain is what really scares me. It's a hard pain in your chest. And I mean, just not being able to breathe, whether you understand what's happening to you or not, is very scary. So, I had faked a front until they put the numbing gel on my lips, on my gums to get ready for the injection. And then I kind of started panicking a little. I cried a little while they were readying things, and I'm like, girl, you need to say something. But it's embarrassing. It's embarrassing. And I'm like, doctors and dentists and nurses hear this crap all the time. Is this a doctor who's going to truly understand? Or is this just a doctor who's going to be like, yeah, whatever, heard it, been there, done that? But no, they were very sweet. And now I feel like a fool, because I should have definitely told them I am debilitatingly afraid of needles. So she numbs the area, they lay me back, they stick the needle in, and I feel pressure. Then I feel the needle way down in my gullet. Like, I'm like, are y'all trying to come out my chin? What is the deal? And it wasn't excruciating, but it was a sting. I felt it deep down in there. And when she pulled it out is when all hell broke loose. I started to shake, and they're like, are you okay? And I'm like, yeah, I'm still trying to fake a front like a dang moron. And then that went into severe shaking, trying to talk through it, fake a front, to my body kind of convulsing, kind of cramping up, and then the breathing became very shallow, very rapid, very shallow, and I hyperventilated, and that's when they're like, it's okay, they they did everything they're supposed to do when someone is experiencing a panic attack. You're okay, you're safe, focus on your breathing, big deep breaths in your nose, very calming, this is what they do. They've seen this hundreds of thousands of times, I'm sure. But yeah, it was a full-fledged panic attack with hyperventilation, and it was embarrassing and it was scary, but they understood. So the consecutive shots, because I needed 5 of them, guys, throughout the procedure. I no longer reacted that way. I didn't react that way anymore, but it was, it was embarrassing. I hate that I react that way. And she's like, boy, you weren't kidding, you're afraid of needles. Absolutely, because I was fine through everything else. But when she would let me know that she was going to give me more numbing, immediately my body starts to shaking convulse. I'm like, I could not control it, but I'm used to it. And I just feel bad that it happened, but they were awesome about it. But the extractions themselves, the only pain I felt was after she was almost done with the second one, the wisdom, because the infection had spread back there. Right when she was almost done with that extraction, I felt the same pain that I felt yesterday and that I have felt all week. This excruciating pain and pressure, so she had to go back in and inject. It's raining. Let me turn these wipers off. It's not raining hard enough for the wipers to be making all that racket. Oh, but I just got a text from little dude's dad saying something. I don't know what he's saying. I'll check when I get home. It is his weekend with little dude. It's a rainy, dirty weekend, but anywho, I forgot what I was saying. Oh, I felt the same pain that I'd been feeling all week because the way she explained it to me, I had an abscess and the bacteria in there is very resistant to the numbing agent because the bacteria itself is very acidic and it kind of, works against the numbing. So that's the pain I was feeling. She got right to the nitty gritty. The tooth was out and now the infection is exposed. The abscess is there. So she's having to drain that friggin' abscess, and I felt it. And after, she drained it, she gave me one more shot for the road of numbing because it was so painful. That was the most pain. And she said, had it not been for the abscess, you wouldn't have felt the pain. You would have just felt the pressure. Because I'm telling you, the extractions were painless. They were painless. But I did it, guys. I've been putting this off for years. But I'm glad I did it. I have to read my Aftercare. Right now I'm heading over to CVS to fill my prescription. She prescribed me an antibiotic for the infection. I go back in a week. It did cost a pretty dang penny. My insurance, I told you guys, is out of network with them. I have an HMO. I need to get to work Monday and see if I still have a grace period to switch my HMO to a PPO, and then I can use it there. But I did go ahead and enroll in one of their packages, one of their financing packages, one of their insurance packages, if you will. So each procedure was half off. Each tooth was half off, plus the nitrous, plus the plan for the year. So it cost a pretty penny, and right now is not when I wanted to have to do it because of Christmas and everything, but it is what it is, and I'm gonna feel better. I'm scared of when the shots wear off, what it's gonna feel like. I don't want to look in my mouth, but then I do want to look in my mouth. Like, I'll probably pass out and gross out with that. I can only imagine what it looks like. They said there's no bleeding, which is good because I'm diabetic. So they were like, you had no bleeding. You had pretty healthy gums. If I experience any kind of, discharge or grossness, it's gonna be from the infection. Y'all fell again. If I experience any grossness, it'll be from the infection itself. But now I just got to work on this side, get these little molars taken care of. They said those are savable. Those teeth are savable. It's just, we got work to do. So take care of y'all's mouth, guys, especially diabetics, smokers. Take care of your teeth, okay? Take care of your teethies. But I'm going to go drop off this prescription. Well, I'll probably hang around at CVS. I'm hungry, but I'm scared to eat. All I've had today is my pain meds. Oh, and they gave me 800 milligrams of something just to get me through the next few hours. And they told me not to take any pain meds for the next 8 hours because what they gave me was pretty strong. But they said I can go back to eating. They gave me the little list of things of what to eat, what not to eat. But it's 13. Y'all know I'm not scared of the number 13 anymore, and it just turned to 13 minutes. freaking scared and paranoid that my diabetes, that, you know, something was gonna make me croak on the chair. But that was when I was expecting to be super sedated. Like, I was walking in there saying, y'all better put me out, man. And I didn't need to. I was able to use gas and those horrible shots. So all this good. I'm just gonna get home and wake up my little dude. I usually wake him up around this time when he's gonna go with his dad, so I'm gonna figure out what his dad is talking about. But I'll see you guys later. Love y'all bunces.